Patient has come with a lot of pain in the low back that includes sciatica. Let us ask her as to how it happened and when it happened before we see the MRI. आपका दर्द कितना साल से है? 4-5 साल से है। कहाँ से, कौन सा पैर से जाता है? बायां वाला पैर से। और कैसे हुआ?
दर्द कैसे हुआ? लगता है भारी हुई, कुछ सामान हम उठा लिए सिलेंडर
हाँ
लगाने के लिए, इसीलिए हो गया।
अच्छा, कितना दर्द था? 10 में 10 सबसे ज्यादा, 0 नो पेन।
10 में 10 ही था।
अच्छा, let us see the MRI before we start treating her left sciatica. Let's focus on the MRI of the spine, lumbar section, lateral view. And you can very well see that there is a huge disc bulge between L5 and S1 right over here, which we have to push it back in place, and this is creating the sciatic pressure on the left leg. So let's do chiropractic treatment to reduce that disc bulge. Let us start with chiropractic drop table, and we obviously need to know that the angle of the sacrum and the L5 very properly. Otherwise, if the gap is not there and if we push, then it might create more problem and discomfort. So understanding the physics behind why and when we are using drop table is very, very critical. And done. We will change the hand position now to directly go between the L5-S1 joint space to reduce that disc bulge. And 3, 2, 1. Thank you. Since it's on the left side, so we are going to open the L5 versus the S1 like this. One more on the left SI joint. There you go. We are opening the L5-S1 again, but from the right side now. One more. There you go. Wonderful. So we are using one of my favorite technique, double-handed flat hammer, to release the posterior chain muscles that includes calves, hamstrings, glutes, and all the other erector spinae. Thus, that's it. Thank you. So currently we are using the hammer and the chisel technique to reset the L5-S1 junction. That's why we are going over the S1, sacral base, sacral sulcus. We are aligning it as much as possible, creating a posterior to anterior pressure. Wonderful. Bas. So now we are using the long lever mechanism to improve muscle activation pattern in and around the joint, which basically means like semispinalis, rotatoris, multifidus. Those are very, very important stabilizing muscles both in static and dynamic stability of the lumbar spine. Okay, fantastic. So we are using one of my favorite percussion hammer gun to release the erector spinae muscles along the thoracic spine and low back. We have to be careful and extra cautious because we are doing it around the musculature and not on the bone. All right. So we are using a traction force and rotating and locking the hip joint, thereby moving the innominate, left innominate bone towards the inferior section. There you go. Hopefully you heard that very subtle crack or click. You will not hear any crack because it's a ligament, not a bone, but I just stretched it so that there is a pop in the symphysis pubis. Again, this is balancing the adductors. Push. এবারে छोड़ दीजिए. Yes. আবার push. One more time and done. Okay, very good. So right now we will be using the final technique to push L5 on S1 in the anterior direction, but a very, very different technique. Chalo. All right, this angular position is very important. Obviously, I need someone else to help me in that. So let's go. 3, 2, 1, pump. Another on the other side. Let's go. 3, 2, 1. Bump. That's it. Thank you. Thank you. So we are done with the treatment, but you know that I believe test, treat, and retest. We are going to ask the patient to bend forward and touch the toes. If she was not able to do it because of sciatica, let's see from her if she is able to do it. आगे झुकना है. That's massive. No, nothing. एकदम नहीं. Like 10 में 10 था, अभी 0. अच्छा, very good. So she is able to bend forward, but please do note, bending forward is a big time no for patients with slip disc and sciatica, but this is for testing purpose only. So we will be giving her customized exercise program. She's going to do it, and then she's going to come back after 1 month probably for a review our recurrences. So if you have any issues like this, or if you like the video, do share, like, and subscribe, and don't forget to leave us a comment. Our phone lines are in the description box or at the end of the video. Give us a call. Our phone lines are open Monday till Saturday from 10 a.m. till 7 p.m.
Thank you, sir.
And stay healthy.